morning, everyone. Pat Zemer here with MagnaWave. Glad to be with you this Tuesday morning for the weekly office hours. Office hours is a time that I come out each Tuesday morning at 9 a.m. Eastern Time and answer any questions that people may have with regard to PEMF therapy, MagnaWave, our machines, devices, whatever the questions may be. So I'm happy to be here. Good morning, Maureen. Thank you for being with us. And I've got a couple of things today. We'll be here for a few minutes. As if people have questions, I will certainly be here to answer them. One of the questions that I've received this week was, what is the protocol for a dog after abdominal surgery? He does have internal stitches, has 2 hernias, front dog bite that had to be repaired. He's had 2 hernias from a dog bite. But at any rate, what's the best procedure after abdominal surgery? Well, what we try to always recommend after any type of procedure like that is that you want to make sure that any bleeding associated with the surgery is contained. In other words, there's no active bleeding as a result of the surgery. At that point, you can begin to treat at a moderate setting, a low to a moderate setting, 5 to 10 minutes to aid in inflammation reduction to the area and to help the healing process and potentially speed up the healing process. It's been shown that what the MagnaWave, the PEMF therapy does is it enhances the healing process of the body, and that's accomplished by improving the oxygenation, and that happens because what the signal does is it makes the cell membrane become more permeable, allowing for the cells to better take up the oxygen that's available to them in the body. When you increase the oxygenation of the blood cells, they're better able to do their job, which is reduce inflammation and thereby relieve pain. It's not a difficult process, but it is a process that is easy to explain and doesn't sound like rocket science unless you want to get down into the mitochondrial level and try to explain it and talk about it. Then it becomes a little bit more difficult to understand. But that's the basic function of what's happening, and that's what you can do. I've had the question again also this week is, what about having a knee replacement? Is it safe to use on a knee replacement, and when can I begin treatment after the knee replacement? And again, the answer is once everything is stabilized after the surgery. I've used it on people that the afternoon after their surgery or the next day after their surgery to again help reduce inflammation, relieve pain, which improves mobility and allows them to get on their feet faster. And so that's the case there as well and also is it safe to use around implants? Well, we always talk about testing around implants. There's not going to be any sparking. It doesn't make anything looser. But over the years, we've not had any issues where it is not safe or is problematic to use around implants, rods, screws, that type of situation. Okay, let's see. Another question that has been posed in a forum online where someone was talking about, oh, I see where they've had a study done, and gee, where was it published? In the Spanish Journal of Ozone Therapy, and they kind of threw that under the bus in their comment. Well, the question is, to me, is that we are making strides to have studies performed. Now, there have been 4 studies. We just completed the 4th study, but 3 studies have been done. All 3 of them, and this 4th one as well, have been done in Cuba. Why Cuba? Well, because it was easy to, it's less expensive to do a study in Cuba for us at this point. We can get, they have good medicine in Cuba, and the fact that wherever it's published, if it's published in a recognized medical journal, is what we're after. We're after something that is peer-reviewed, something that can go into a journal. What the key to us is there have been many, many studies over the years of utilizing PEMF therapy devices, and many different devices, many different studies, many different settings. But most companies today that are operating have not done studies with their equipment. And we felt a few years ago that it was important in some fashion, as best we could, was to perform some studies utilizing our equipment, so we can say this is what's been found with our equipment. And so that's how we've chosen to go about it. But studies are very expensive to undertake. They are not required for many different uses of the devices, but we did want to pursue that. Now, as you know, and we've talked about this for a long time, the MagnaWave and the PEMF Systems devices are now CE approved for use in Europe, and will soon be Health Canada to be allowed to be used. And then that means that we're set up. They are safety tested. The digital devices, the Maya and the Semi, are safety cleared in the United States, which means two things. We can go ahead and pursue the FDA, and we can also export for human use out of the country. And then we have 3 studies that are being finalized here with the safety approved devices, and that is at the Henry Ford Hospital in Detroit, University of Miami in Florida, and the Los Angeles Veterans Hospital are all going to be doing studies on the equipment, one on venous healing, one on bed sores, and one on arthritis and inflammation of the knee and elbow. So that's kind of where we are with those particular type of areas. Again, in this same forum, somebody was saying, well, anecdotal and things that are not proven. Well, there are many devices that are proven, are FDA approved in the United States for brain cancer, for bone healing, for autism, for depression, for incontinence, that are very accepted, very understood, and very well utilized PEMF devices for those particular indications. So just wanted to approach that. Those are questions that have been asked. If you have a question, just post it in the chat box here, and I'd be happy to answer it for you before I leave. I did receive a question yesterday. How long, if someone is interested in using this device, how easy, how long, what do I need to do to start a business, and how long is it going to take? And one of the things that I've always said when people ask me about the viability of having a business with MagnaWave, I got into it as a business. I did not get into it originally to sell machines and to supply training on machines and all of that type of situation. My goal when I got started was to, in fact, treat horses and people. That's the industry I was in. I've been around in the equine industry since 2002, been doing PEMF therapy since 2002 in the equine industry, and so that's where I was. And so that's where my experience comes from. But again, so I've been and then all of a sudden, here we are, we're selling machines and helping people develop businesses. And in many respects today, we're in the business development stage. People come to us, they say, I want to have a machine, there's nobody in my area, I want to start a business. And so here it is. Let's say you started this in April the 1st, and now it's the 22nd, 23rd of May, and gee, I'm just not getting all the clients that I want, and I'm not getting things to go the way I want it to. Well, it's not like falling off a log. I've always said that if you believe in what you're doing, people can see that you believe in what you're doing, and you have a good bedside manner, then you can be successful in this business. Are you going to be able to open your business, put a couple of posts on Facebook that you have the equipment, give me a call and I'll set up a meeting with you? No, it doesn't happen like that. You need to invest time. You know, the situation is, if you are doing something and let me pull it up here, people think that things will come quite often without work. You know, I've got a machine, here I go. Well, you know, in reality, it probably takes, once you do the training, you probably need to treat 50 horses or 50 dogs or 50 people to really begin to understand how it works, to begin to understand that every person is not the same. How you work on my back and someone else's back in order to relieve some inflammation or to relieve pain may be totally different. Where is the pain originating from? And people can tell you that. They can say, well, gee, it's right here, or it's right here in my wrist, but actually it's coming from the shoulder, or it's coming from the low back. And so you got to learn and you got to experience. So to get into a situation and think, well, 35 days later, I'm not getting the calls that I want. It doesn't happen that way. You'll find that you got to match your ambitions with your work ethic, and you got to work hard, and you got to talk hard, and you got to do demos. People have said, "Well, I'll do one demo." And I thought about that. I remember when I started, all I did was demo. And then I'd pull back. I'd treat somebody's horse 2 or 3 times, or I'd treat 2 or 3 of their horses, and then I'd move on. And they'd go ride, and they'd realize, gee, this horse is better. They'd eventually have me come back, and because they'd see that it was better, and it lasted 3 or 4 days, or it lasted a week. But you have to, the best value you have is to give somebody a demonstration, show them how it works. I've had people say to me, well, I do demos. I give them a 5-minute demo, and they can see it on the horse and see it working. Well, my feeling is you give me a 5-minute demo, and I stand up and I don't feel any different, or I get on my horse and it doesn't perform any different, or my dog still gets up and limps away. 5-minute demo is nothing. If you don't have the time to invest in that person to really show them that it's going to work, because the reality of it is most of the time it's not a one and done. It's not a situation where you treat this horse or this person one time and it's over. It's unfortunately they didn't get to the state they're in a day. Now, if you go out and work in your garden and you get gardener's lament, you can come in and treat yourself and then you feel better. Yeah, okay, that could be a one and done. But in many cases, I've got a bad knee, for example, tore my patella tendon, and I got to treat it pretty regularly in order to keep the pain at bay, in order to keep the inflammation under control, and keep everything going the way I want it to. And so my recommendation to these people is you got to invest the time. You've got to supply the demonstrations. You've got to be totally secure in what you're saying. And you can't just post 2 or 3 times that you got it and give me a call. I don't think anybody called me in the beginning. It was a situation where I was out day in and day out, meeting new people, showing them what it would do, and as time went on, I was very successful providing treatments. And because I believed in what I did, I could talk about it confidently, and people could see that I believed in what I was doing. I mean, I was dragging this box around, and people would look at me like I was crazy. What is he doing? What does he think he's doing? Because I had been a salesman of these devices. I hadn't really been a practitioner. So I had to get over that hump. I had to say, okay, I understand this. I've been doing this for years, but I haven't been physically doing it. I've been supplying you with the equipment, showing you how to do it, and then you would go do it. And so you have to get over that type of situation. So let me see here. There are a couple of questions. And one other thing is today, as far as business development is concerned, it's an equal playing field. Somebody may come into this game with $100,000 in their pocket and can advertise like crazy, and somebody come into the game with not a lot of money, but you have the internet, you have Facebook, it is free, you can go do things, you can send people messages with your phone, the whole aspect of money phone that we talk about, or we have talked about on this particular program. So you have a lot of availabilities today in a very level playing field with the internet. It's changed the whole game for everything to utilize the internet, and what's the best way for you to do it. Can you do that for $25 a month or $50 a month? Yes. Can you do it for a few $100s a month? It depends how far you want to go and what you want to accomplish. But you have to take that step. You have to put yourself forward, and it is not like falling off of the log. I wish it was. It'd be easy to do that, but it's not. So it does take some work, and I want to always be perfectly clear in that type situation. Let's see. I just bought the Simi and working on the certification. I'm 8 months pregnant. Can I operate it, or do I need to wait? Well, Carolyn, that's a question that you want to take up with your doctor, or you want to look at. Do you want to, there have been people that have figured a way to wear some various garments. you know, you're a month and a half away from or a month or so away from having your child, and then, you know, 4 to 6 weeks away from really being able to get back out there. Certainly, you can be in the room with the machine. I mean, people are a lot. Do you want to treat yourself? No. You know, we always talk about when we're treating. I'll just give you a perspective here. If you've got the coil on an area, and all of a sudden someone feels, well, that's a little much for me, and you're not close to the machine to turn the machine up or down. If you lift the coil, just lift one part of the coil an inch or 2 inches, you've cut that signal basically in half in terms of what's being delivered to that person. So if you're a foot away or 2 feet away and you're utilizing, then, you know, you're in a situation that you're not really being exposed. It's not the waves that are an issue. I mean, if that were the case, the idea of being near a microwave or talking on your telephone or sitting in front of your computer 8 months pregnant, still working potentially, there's a lot of waves and radiation that's coming off that are coming into your body that can potentially affect your body. Are they going to be dangerous to what's going on? Obviously, people are allowed to work and when they're pregnant and do things like that. So there's situations to consider. And that's what you always want to look at. So I would, you know, you can discuss it further. I know some people who have been pregnant and they got to their 8th or 9th month and their legs are killing them or their feet are swelling up, and they'll treat their feet and they'll treat their ankles to feel better. And to do that, would you want to treat the area of the baby? No, of course not. And it's always contraindicated. And we've had that in horses where people have said, well, my horse is, my mare is in foal, and what am I going to do? But the horse is foundering. What should I do? Well, I mean, you don't want your horse to founder and die, because then you lose your foal anyway. So there's always a place of balance in a lot of these types of situations. Certainly we are right there with what I'm sure any doctor would tell you, not to treat yourself or when you are pregnant and doing things. And so people have done various things and with regard to their pregnancy, and that's something that you need to discuss and probably should think about. But it's your case, 8 months, and you're close to having the baby, and then, you know, getting down the road. That's good advice as well. Does that mean you shouldn't take the training? Does that mean you can't have somebody using the device in the room that you're in, discussing it with them? Of course, you can be approaching that, and I would think very cautious, very safely, without any concern or worry. Okay, another question. Let's see. Tim asked the question, any known case studies with this therapy on paraplegia? I don't know of any specific studies. We could take a look and see. I could Google that. I'll do that, Tim. I'll take a look and see what the situation may be there as we're going. I don't want to stop and start typing, because then you'll just sit there and watch me type. But I will get into that and post an answer to that question as well. Great question. Thanks, there we go. Let's see. Here, Carolyn asks a question again. I also have let me just put that up here. I also have an elderly horse on my farm that has Heaves and beginning COPD. Would MagnaWave benefit the horse? Well, absolutely. The situation is, when you get with a lot of these types of issues, is you want good blood flow, you want good oxygenation to the lungs, and so you want to, that's a good overall treatment for the horse. A lot of times we don't talk about specific conditions, because a doctor can do that. A doctor can go in and say, this is what the issue is, and this is what I'm going to treat, and this is how I'm going to apply this, and this is what I'm going to expect as the result. As a practitioner or a person looking at it, what we try to look at is the fact that as we treat this particular animal or person, is the enhancement to the blood oxygenation that we can receive and give benefit to. If you can improve the oxygenation and improve the blood flow, and we have it on the website, and there's various places where you can see how the blood flow improves after just a few minutes of treatment. I'm talking about systematic blood flow, not surface, not capillary, not micro microcapillary blood flow. I'm talking about systemic, the whole body type of blood flow. You'll see the white blood cells, the size of the white blood cell dramatically increase. And so if you have good oxygenation, good blood flow, good blood like that can work miracles in the body. When the body becomes unhealthy, the normalcy of the cells diminish. They don't have the charge that they're just supposed to have. Their batteries aren't charged, so they're running low, and they can't fight. They can't do what you want them to do. So if you help keep it energized, and that's what we're all about. We're basically recharging the body's batteries in each cell, recharging the cellular batteries so they can better do their job. Will that help various indications? Yes, potentially, just by virtue that things are being in a position to be better serving to the body. Let's see. Family member, another question from Laura. Family member had let me pull that up just a second. Family member had a motorcycle accident, is home from the hospital now a week. Can I start treating him? Plates and shoulders, 13 busted ribs. Whoo, boy. I can't think about having 13 broken ribs. Again, if they're home and they're stable, I'm sure there's pain, inflammation. We want to help enhance the healing process of the body. Typically, plates and screws are not an issue. You always want to check, put it on the area where the plate may be, turn the machine on, let it run at a moderate setting for 2 or 3 minutes and see if there's any discomfort, see if they're okay. If they're okay, then do a normal treatment. Again, how does it feel? Does it feel like there's any issue going on there? And if they're comfortable, you can treat. If there's a concern, you might want to talk to their doctor or have them ask their doctor. But as a rule, over the years, those type of situations in horses and animals to work on screws and plates has not been an issue. And certainly the discomfort that the person may be feeling in the rib area and their back, certainly, obviously, there's overall soreness all over the body just from that type of trauma that this person experienced in a motorcycle accident. Just to, again, help the blood oxygenation and the blood flow can help the body better control its inflammation everywhere and help things feel better. The body feels just primarily one pain at a time. You may be hurting all over, but you got something that's hurting more than something else. The brain wants to key in on one pain. A lot of times if you work on that, then you can kind of chase the pain around the body and help the situation. Again, going back to the fact that you don't want to, this does not increase blood pressure, but it does improve blood flow. It lets the blood flow more freely through the body. So you want to make sure that there is no active bleeding going on that we can enhance. We don't want to do that. So we want to make sure that all bleeding is controlled and everything's in good shape. And then you can certainly go treat someone to help them feel better and get along with the healing process more rapidly. Great questions today. If you have any other questions, folks, just put them up here and I'd be happy to take a look at them and approach them. I had some very good questions. I certainly appreciate that. We have Magna Con coming up in June. June 13th, 14th, and 15th. If you're a doctor, a chiropractor, a veterinarian, or a practitioner, and you want to learn more about MagnaWave and more about you're welcome, Laura, and more about what we're doing, this is a great place to come and experience the machines firsthand, talk with doctors and chiropractors and practitioners who have been using this equipment for years. We have people that have been with us since 2007. And have been utilizing this equipment. We have 400 people plus in our practitioner portal where people ask questions and get information and about the equipment. And they're going to be at this Magna Con. So it's a great place to come and really learn firsthand for yourself. Besides that, we have some fun. People say, well, you're charging us to come. Well, we are, because we're supplying lunch, we're supplying education. We also go to Churchill Downs and have a great time, great meal at Churchill Downs and enjoy the racing and see things firsthand there. And then we have a gala on Friday night. This year it's a Derby gala. So if you're coming, bring your finest Derby attire and you'd have a lot of fun. So come join us at MagnaWave. And it's a great way to do it and learn a lot about this and how you can implement this therapy for your clients, for yourself, to feel better and enhance the overall healing process. Laura has one more question. Let me bring this up here. Okay, let's see. One more question. Carpal tunnel. How long does it take to get results? Well, Laura, it's not unusual that you treat someone and they have a better feeling immediately. Now, the challenge with carpal tunnel is it didn't, it's maybe starting to bother you now, but it's been creeping. It's been coming for some time, and all of a sudden it's there. It's much harder to get inflammation out of a nerve or a tendon or cartilage than it is out of a muscle. So we're going to have to work that area diligently, but it is possible to treat someone with carpal tunnel, to treat their wrist and have better feeling and better movement after one treatment. Maybe one 10 or 15-minute treatment. But a lot of times we have to talk about the wrist area, the elbow, the shoulder. My son-in-law, for example, has some issues with that, and it's originating from his low back. The doctor talks about how it migrates through the body. And so, you have to look for the areas, be consistent with treating the areas, but on the surface, and that's one of the reasons that we're having this conversation today, is because this therapy works very quickly. It was amazing. People, we all want instant gratification. You feel bad, you want to feel better. And when you start dealing with arthritic and muscle soreness and muscle bruising and all that type of stuff, this can help immediately. And is it going to reverse it immediately and make it go away? No. Can it? Yes. But that just depends on each individual situation. Great question, Laura, and I appreciate that. And let's see, we have another question. It looks long here. Let's see here. Let me pull this up, get it up here now. Okay. Oh, that's not it. Let me come back. Let me get rid of that. Sorry, that's information on the, here we go. Let's see. Has there ever been consideration for creating a boot for horses similar to the one, the Soft Ride Ice Spa, but just for PEMF to be able to do horses whole leg and hoof at once? Well, we do have, there's a couple of ways to think about that. If you took the large loop and you wrapped it around a horse's leg, in other words, if you have the hoof like this and you wrap it around the leg, so it's going around the leg, you're going to be treating up and down. And I ought to get a coil here and show you exactly how that works. In fact, I'm going to do that. It'll take me just a second. Don't leave. Okay, so here I've got the large loop. And if I take this loop and I put it around to where if I put it around so it's like this, I've got to get back here for this so you can see this. Let me drop this here. I'll bring it back. So if I wrap it to where it's like this over the leg and it's connected in the back, so I'm doing my wrist and I'm doing my elbow at the same time. You see I've got two loops there, one on my elbow and one on my wrist. Well, if you're on a horse and you've got this resting above the hoof, or let's say above the hoof from here and below the knee here, you're doing up and down the whole leg and the hoof at the same time. And so that's one way to look at that. Could we do a boot? Of course, a boot could be utilized, but then you got the situation that you're going to strap it on, and what if the horse moves and pulls the coils out of the machine, that type of thing. And the length of time of the treatment is short, but again, if you do this, you can treat up and down the leg. If you do this with the butterfly, you can put it over the hoof and the ankle and do the hoof and the ankle at the same time, or certainly do the knee at the same time. So yes, you can go up and down. And then we also have now remember, this can go very far as its penetration. So if you have the horse standing on the hoof box with the paddle, and you're going up the leg, you're going through the hoof, through the ankle, up towards the knee, penetrating up that whole area. So you're really treating it, even though you don't have this wrapped around the area. Great question. Let's see. She had some more on there. Let me pull that back up. Hope that helps as we go along. I have a mare with... made it. How do I do that? Well, learn something every time. I can make it bigger or smaller. I have a mare with really sensitive feet. Oh, now I got to be able to read it. Imagine that. Come on. Oh, okay. Have a mare with really sensitive feet. It's helped her a lot, and a full boot to do hoof and leg at once would be wonderful. Could you point me in the direction who to contact about such an idea? Well, you've contacted about that type of idea, and we can take a look at that. But again, if you just wrap that coil around, rest it on the top. Now, you could use, depending on which machine you have, if you have the splitter, you could put the foot on the hoof box and wrap the coil around the leg at the same time, and you could turn the intensity pretty high because you're not dealing with a lot of soft tissue and the hoof at the same time. And you could treat that whole area. You could use a splitter, treat the foot, treat the leg with 2 different attachments at the same time, and be finished in 5 minutes. 5 to 8 minutes, you've completed that on that particular area. And frankly, if you did that and you wrapped the coil around the leg, put a piece of Velcro on it, stood it on the hoof box, you'd have the same thing as a wrap to be able to be used. The challenge that we've always had with some of these types of things, it's like the hoof box. The paddle is usable on the shoulder, the neck, anywhere. You put it in the hoof box, you've got double use for it. And because we have the box. The challenge we've had sometimes is if you make a pad and you build, in fact, I did that. At one point in time, I had a hock boot. I built a hock boot that I made available, and we put it on the hock. Well, it really wasn't easy to use anyplace else. And the way it was designed to really fit a hock better than it was to fit a knee. And people liked it, some people used it, but it really came down to you have all the tools that are really available with the attachments the way we have them. You could take the large wave wings and wrap them around the leg a couple of times and really get the whole leg at one time with the large wave wings, the way you would wrap them around and they put some Velcro on it. Why Velcro? Because if the horse moves away, it's going to pull loose, drop to the ground, and you don't have damage to your machine or anything else. Great question. I hope that helps, Michaela, and appreciate the question, though. And if you have other questions, just simply let me know. Good questions, folks. Let me see if there's anything else. Oh, okay, Michaela, you're welcome. Tracy asked a question. Let's see what we got here. What is the best approach and benefit for Bakers Cyst up and down with big loop or butterfly directly on it? I would say probably both. Again, remember that tissue responds better when it's approached from different intensities at different directions. So you want to go, sometimes you'll want to put the loop on it and go this way. Sometimes you want to wrap the loop the way I was just talking and go up and down the area. So you can approach it from various areas. But I would think primarily that you'd use the butterfly, put it right over the area to be treating it. You want to get the flow from the area. You want to get you get inflammation reduction in the area. You want to get good blood to the area so it can help heal what's going on and fight what needs to be fought in that particular area. So I would say both, Tracy, but you can't go wrong putting the butterfly right on the area and treat the area itself. Used to do that when a horse would get a splint. I mean, I'd go right after it with the butterfly, turn it very high, and just be right over that splint to go through it and to hopefully relieve it. And we got very good success in dealing with those types of situations. So good morning, Leanne. Appreciate you folks being here. Let's see if you have any other questions. We've got a lot of folks with us this morning. I'm very thankful for that. And again, if you have any questions, I'll stay for a few minutes. I have another meeting here in about 20 minutes. But if you've got a question, please put it up here and I will be sure to answer it at that time. I'm trying to think if there's anything else off the top of my head that we've been asked this week that we now need to have a look at. I'm trying... I can look here and see, but oh, here we go. Here's a question. Let me bring this. Oh, let's take Tracy's down and come over here to this one. I have a horse with significant bony changes in his neck and sore heels that I've been treating with MagnaWave. He's still slightly unsound and are going to the EPM meds. Certification says MagnaWave after EPM meds, not during. Should I stop treating his neck until the EPM meds are done? Well, typically when we're talking about EPM, and it's funny how things change. In the beginning, when we first started dealing with EPM, when we treated an EPM horse, we found very quickly that if they're sore and we treat them, a lot of times they're sorer after the treatment, and you have to treat multiple times. That's why I've always said in the training, and if someone asks me if you're going to treat an EPM horse, don't say you're going to treat it one time, or don't treat it one time. If they say, come treat my horse one time, I wouldn't do it. I'd say, look, it's going to take multiple treatments. I don't want to make you think that I've made your horse sorer. And because a lot of times what happens, you have the parasites, and they're in the top line, they're in the nerve area near the spine, and they're there. The medication, and there are some doctors now who talk about MagnaWaving during the medication. Others say wait till after. Well, we've kind of taken the position we don't want to contradict what people want to do, and so we've kind of taken the position that if a doctor is using something, let's say an infection, and are treating with antibiotics, we wait for them to go through the antibiotic treatment, and then we treat. Let the antibiotics do their job. Same thing as the position that we've kind of taken with EPM. However, if you talk to the vet and the vet understands what we do and how we do it, you can potentially continue to treat during the EPM treatment. To specifically ask your question, can I treat the neck while the horse is on meds? Absolutely. It's not, if you're treating the neck of the horse, and up here, yes, you're going to enhance blood flow to the body, but you're not moving any parasites. You're not doing anything in the area where there is soreness as a result of the EPM. So can you treat the neck for that at that point? I would think so. Would be something that you could do. So there you have it. But again, you might ask what happens, and what we kind of figured. And again, we're not veterinarians, but we think about this as they give the meds to kill the bacteria, kill the parasites that are there that begin to get into the and cause irritation to the nerves of the body, which then causes the pain and so forth associated with it. Is we don't want to move that parasite. We want to wait for it to be in a position to be totally non-aggressive to the body, and then we want to help move it away. We want to help get rid of the problem at that point. Help get it into, if it's decaying, help get it into the lymphatic system and away from the body. So that's what we've always dealt with in that type situation. So you don't want to move, if you've got a little infection here, you don't want to move it over here and have it different. A new indication or a new source of pain or inflammation to the area. So, great question. I hope the answer was sufficient. If you have further questions, I'd be happy to answer them. Let's see. We got a question from Maureen. Great results on Bakers Cyst with the butterfly. Maureen, thank you so much for sharing that, and we've noticed the same on when people have cysts, and again, we're dealing with a inflammation. We're dealing with something we need to try to get good blood flow, good nourishment around it to take care of it and have it be controlled. All right. Any other questions? I'd be happy to answer them. Just put it up. Here we go. We have a question here. All right. What is the best approach to treating sore stifles? Well, if Aaron were here, and I'm sure Aaron is in the building, the best approach is to put it on and treat it. And certainly you want to treat the area of the stifle on the horse. You want to treat the area around the stifle, the hips and the back of the horse, but just go right to the area and treat. And it's interesting. I tell this story a lot. When I first started, and I'd go to the racetrack, and I'd go to these trainers, and I'd talk with them, and it was, we have a lot of problems with stifle. I'd go treat the stifle. No movement. but yet the horse was having some issue, and I'd go up and I'd see movement in the hip, or I'd see movement in the sacrum, or I'd have things, and so they were, referred pain and how it's affected in different areas. So you really sometimes don't know. But and my story is, I was in Michigan, Traverse City, Michigan, and I went in to treat a horse for a customer, and I was going all over the horse, and I got to the stifle, and I got some reaction that I normally don't get, meaning if you don't get reaction, then things are pretty stable. But I got reaction. And so when I was finished, I went to the owner of the horse and the trainer, and I said, I got some movement out of the stifles that I don't normally get if they're good and stable in the stifle area. You might want to have it checked. You might want to let your vet know and have them come look at it. So I go on, and I'm treating some other horses, and 5 or 10 minutes later, the vet shows up and walks in the stall. So you told them, he says to me, that this horse has bad stifles. I'm going to, I said, no, doc, you don't and it was a friend of mine. I knew that, I've known the doc for years, and he said that, and I said, no, I didn't diagnose anything. I simply said I got more reaction in the stifles than they normally get. And his reaction to me was, well, I think it's in the back and the hips, but I'll check. So he went and checked, and I'm doing another horse, and I've got some squeaking going over here with my chair, but I'm doing another horse, and all of a sudden I see the vet go walking by, and I'm thinking, he's going to stick his head in the shed here, in the stall here, and tell me, you be quiet, or whatever. And he walked by, and then all of a sudden he stuck his head back in. He said, you were right. I had to treat both stifles. He said, I sure thought it was up in the back. And so that was the situation that I was dealing with. So to answer your question, Leanne, is to treat it. And I would say you treat on a moderate, comfortable setting. If you're getting movement there for 8 to 10 minutes, if that you're treating that area specifically, but I would certainly treat the area around. Again, our logic for treating the whole body of a horse is we want to help the blood oxygenation and the blood flow throughout the whole body. So for the next 8, 15, 20 hours that blood is in good shape and good oxygenated blood, where's it going to go? It's going to go to that area. And so we want to reinforce what we do. That's the whole basis that we have for, that's the whole basis that we have for the whole body treatment, is to help the general situation of the whole body. So great question. Appreciate that very much. Let's go. I have another one. Let's see. Thanks. Okay, are we still there? Live broadcast in progress. Cancel. It's trying to install updates. My computer's telling me stories. Okay, so here we go. Marion asked a question. I have horse I'm treating with Lyme. How frequent should I treat this horse to start? 3 times a week, once a week? Well, Lyme is an area that we've treated people with Lyme, certainly, and we've had situations where we're treating animals with Lyme, and it'll center. It'll be troubling them in one area. Can you treat that horse 2 or 3 times a week? Yes, and it may be very good doing that, and things may work out very well in that type of situation. So for sure, you can do that. So I would say 3 times a week would be great. Once a week, yeah, you could do that, but I would think, a lot of times I talk about when you're going after a specific situation, treat it 3 or 4 or 5, if you can, and if the person will agree to that, treat it 3 or 4 times to get maybe ahead of what you're doing. Get the whole body really cooking to help this situation improve. And so, yes, you can do that. I would treat 2 or 3 times a week to potentially get ahead of it. There's been folks, it's been amazing to me that over the years, the number of people who have come into our system and purchased a machine specifically for Lyme disease. And a chiropractor, a friend of ours, had Lyme disease. In fact, this is how we got this particular person really to come on board with our devices. She had Lyme disease and had tried it, had it for some time. It was kind of centered in her abdomen and in her mid-range of her body, just above her abdomen area, and she treated herself 1 time, and it was better. And so that was that solder on what could be achieved and what could be accomplished utilizing this type of device. Other people have to treat themselves ongoing. It's a serious enough area or a serious enough indication for them that they don't ever get rid of it, but they can keep it at bay. They can keep the symptoms down. They can be comfortable, but they treat themselves once a week or twice a week, ongoing. And if that's what it takes, we always say treat as often as necessary. Treat as often as necessary treat as long as, here we go. God, treat as long as function continues to improve. So if function is improving, continue to treat. Once you reach a plateau, treat as often as necessary to maintain the plateau. Sometimes it will go away and you don't have to treat at all, but that's the situation. Treat as long as function continues to improve, and then treat as often as necessary to maintain the plateau that you've reached, or maintain the function. So there we go. Good question, Marion. I appreciate that. Well, let's see. We have another question. Let's come up here and have a look. Speaking of stifles, a lot of horses seem to be getting stifles and knees injected. Any wait time you recommend after injections before starting MagnaWave therapy? Well, again, that is a personal type of situation. Back in 2007, 2008, when they would inject an area, we would pretty much just keep right on going. If they're injecting a knee or something like that, and they're injecting into the bursa or into the joint sac, if you will, it's not going to leave there. It's going to be there. And so the fact that you're treating up and around it or below it to help the blood flow to the area and help everything, it's okay. But in some cases, people and veterinarians have suggested that wait 24 hours, wait 48 hours, let the injection do its job and better facilitate the area, then come in and support it. So we have folks that wait 24 hours. We have folks that will wait 48 hours after injection, let it do its job and go from there. Again, it's down to the recommendation of what the veterinarian calls for, because that's what we want to follow, or what the doctor, if you're dealing with a person or a small animal, calls for, what is normal in those types of situations. So that's always, there is one thing, and we've talked about this, it is in the training. If you want to take the training, we certainly recommend that you do so. But sometimes they'll inject an area specific, like they'll go into the bursa or to the joint sac of the body. There's other times where they'll inject into the muscle and to potentially block something in a particular area. Well, you don't want to MagnaWave then, because you don't want to disperse what they've done or what their object is to do with what they're out to achieve. So that's just the thing that you want to keep in mind. So if someone's talking about their horse being injected, you certainly, or their dog, or themselves, you want to talk about what they're doing or why they're doing it. Which brings me to a point when you're talking about cortisone, for example, a cortisone shot. They're giving a shot of cortisone to the back or to the knee or whatever it is. Typically, I'm not a fan of cortisone injections. It covers things, and you can go treat after a cortisone injection, and you're not going to do any good, because it's there, it's doing what it's intended to do, and it lasts a good 30 days. So we always say if there's been a cortisone injection of a knee, it's not going to do you any good to treat that knee for 30 days, because the cortisone is blocking everything that's going on there. I don't care for that, because a lot of times the horse will, or the animal will, work through that, and all of a sudden when it wears off, it's worse than it was at the beginning. I don't understand that, don't know all the specifics to that, but that's always something that we talk about. So you always want to find out what they're doing, what the injection was, what the intention is of the injection, and work accordingly. If you have questions when it comes to that, give us a call. And if it's something that we're not familiar with, then we'll get with our veterinarians that we work with, or our docs that we work with, if it's a human type of question, and ask them what their recommendation is or what they think in order to get back to you and give you the answer. We may understand. Our whole goal is to be empathetic to what you're doing, to understand what you're doing with, but we don't know all the little specifics, so we want to work with you to better help everybody understand what's going on and how it works. So great question, Terry. I hope that helps. We're sneaking up on being just about out of time, so if you have any other questions, put them up there now, and I'd be happy to answer them with the few minutes that we have left. I really appreciate you joining me this morning and watching the program and asking some great questions, and we're always happy to answer those questions. And if you're watching this and you are a small animal person, or you are a chiropractor for human people, or you're a physical therapist for humans, and we have a lot of horse questions, or people talk about horses, because we have a lot of people in the horse industry that use this device and have been very successful with this device on their animals or themselves or whatever. And the correlation to make is if you're just thinking joint issue, or you're thinking back issue, mammalian, from the mammalian perspective, it's the same. So if we're talking about treating a foot, we're talking about treating a hoof. If we're talking about treating a hoof, you can apply the same thing to when talking about someone's foot, or the knee or the ankle, that type of thing. So I know people have said, well, all you do, today, for example, we've talked a lot about horses, and there's other times we talk a lot about human aspects or small animal aspects. Well, there's such a crossover that's the thing. But that's one of the things that happens so often with devices, is they start in the veterinary world, because you don't have to have FDA approval to be in the veterinary world. You don't have to do some of the things that are required if you're going to have it in the human side of the human side of treatments for insurance purposes and so on and so forth. So a lot of things have grown through the veterinary channels to be very successful in the small animal and human, or small animal is veterinary, but to be very successful when applied to the human side of the spectrum, or the use of the various therapies for health and well-being. So it doesn't look like there's any other questions. We're about out of time for this segment. So again, I thank all of you for joining me. If you have questions, simply post them on the Facebook page. Send us a message. We'd be happy to do it. If you have something that you'd like for us to deal with specifically, that we can have a webinar and deal specifically with this issue in depth on a webinar, we'd be happy to do that, whether it's for people, small animals, or horses, or cows, cattle, pigs, whatever it may be that people are specifically dealing with. We certainly want to answer those questions and fulfill those needs as people have them. So again, our whole goal is to be transparent in what we're doing, to be free to answer your questions and to help you, so we better understand what you're dealing with as an individual using this for yourself, or a person using this on your animals or in your practice, to help you get there. We don't always, you're dealing with things that I've never experienced. Perhaps I know what they are, but I want to learn from you so we can all learn together. That's really what it's all about, how we can help our practitioners, whether they're small animal, large animal, or human, be more successful and provide more health and wellness to their customers and their clients that they may be dealing with. So again, thanks for being with me. I certainly enjoyed this. I'll be back next week again for the MagnaWave office hours Tuesday morning. So thanks again. We'll talk to you later. Have a great day. Bye-bye.